Hello, and welcome to this session from Kyzer HIT Consulting. In this session, I'm going to quickly go through the doctor's care clinical intake workflow and demonstrate all of the necessary elements when documenting. Starting from the tracking board, step 1 would be to move a patient from the waiting room into the triage room of your particular practice location. After that, you would then open the patient's chart. I have a test patient already pulled up, and we will get started by assigning patient pharmacy. In this case, my patient already has a patient pharmacy assigned, therefore I would just confirm with the patient that this is still accurate, and if it is not, I would need to add in an additional patient pharmacy for that patient that is current. Next, I'd get started with my quick intake. Put in my chief complaint. In this case, we're going to do an example with lower back pain. Record your blood pressure, heart rate, and you could also record other vital signs such as temperature, respiratory rate, and oxygen saturation if needed. Once we've completed the quick intake, we're going to go ahead and sign the form to the chart. Next, we're going to move to allergies. In the case of this patient, we're going to assume the patient does not have any allergies. Therefore, I want to make sure that I click the button that says No Known Allergies. In this case, we would have satisfied the meaningful use measure for documenting allergies. I'm going to return to my home screen and then document home medications that my patient may currently be taking. After I click on medications, I go to the Documented Medications by History button, plus Add to add any medications. In this case, I'm just going to say that my patient is on a multivitamin. After you find the particular medication, we can sign it by saying Document History. You would of course add all the medications that your patient is currently taking through the Documented Medications by History component. Returning to the ambulatory summary screen, we're now going to review the problem list under Diagnosis and Problems. And in this case, I'm going to go ahead and add chronic back pain per the patient. You can start with a partial search, and in most cases, you'll be able to find what you're looking for. Since this is the only item that I need to add, I'm simply going to say OK. It's important that when you're adding problems that you do not use the free text box that is available under the plus add screen. That way it keeps from when the provider tries to convert that to a diagnosis, the computer not properly being able to convert it since it wouldn't be mapped to an ICD-9 code. Now that we've got our problems addressed, and in this case my patient is relatively healthy with regard to problems, so we're not listing any additional ones. Next, I need to look at the social history component. By clicking on histories, I'm able to review past medical history, and I can also add at this point, I do want to mark as reviewed procedures and surgical history. I could add at this point as well, and I do want to mark as reviewed. Bear in mind that when adding surgical or procedure history, it is acceptable to click the checkbox that says use free text, since these do not typically get mapped to problems and diagnoses. Family history, I could alter at this point if there were additional pieces of family history. Let's say, for example, that the patient's father has high cholesterol, and we'd like to document that. Social history, I have tobacco status already confirmed, which is a meaningful use measure, and in this case I want to mark as reviewed. Pregnancy, there is no pregnancy history for this patient, so we can simply skip. At this point, I would commence ordering any protocol orders that I may need for my patient. Since I'm doing a lower back example, there would be no particular protocol orders that I would need to execute at this point. So the last step that I need to do before the provider goes in to see this patient is return to the tracking board and move my patient from triage into which exam room I'll be moving the patient into, and then selecting OK. That will signify to the provider that the patient is ready to be seen. Thank you for taking a few moments to review this clinical workflow from Doctor's Care for the clinical staff role.